हेलो हाय आदाब और सत श्री अकाल। और एक बार फिर से आप लोगों के बीच आ चुका हूं मैं, आपका हमराज आरजे अभिनव 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर दोबारा से लेकर आए हैं आप लोगों के बीच हमारा बहुप्रतीक्षित फेमस शो नो योर फैकल्टी, जहां पर आप एक डिपार्टमेंट से, एक स्कूल से हम एक पर्सनैलिटी को बुलाते हैं, एक टीचर को बुलाते हैं और उनके बारे में जानते हैं वो बातें भी जो भी आपको अभी तक नहीं पता है। आज मेरे पास ऐसे ही एक और शख्सियत बैठे हैं। वो आए हैं स्कूल ऑफ नर्सिंग से और जिनका नाम है मिस्टर प्रसाद कानावड़े, जो कि वहाँ पर असिस्टेंट प्रोफेसर हैं। सर, गुड मॉर्निंग, हाउ आर यू एंड वेरी वार्म वेलकम हियर।
Good morning, sir. Thank you, sir, for inviting. It's my pleasure to be here, to be a part of your show. As I want to introduce myself, Prasad Kanawade,
जी
working in the D.Y. Patil School of Nursing as a very prestigious organization since last 5 years.
Oh wow, yes, definitely.
And this 5 year of journey that taught me a lot and many things. I remember the first day I joined there. So it was a very much the scare, like how I can survive there. But I'm very fortunate to my principal madam. It was the time the Rita madam was the principal, and all other faculty members that they helped me to grow in the organization, supported me. I will not remember those days like initial where I gone through the various challenges and I come up with those challenges very effectively. So I must say thanks to D.Y. Patil for throughout this successful journey in this field of nursing.
ग्रेट। पहले क्वेश्चंस का आंसर आपने खुद ही दे दिया है तो पूछने की जरूरत नहीं पड़ी। सेकंड पूछता हूँ, व्हाट मेड यू चूज द फील्ड ऑफ नर्सिंग, हाउ डिड यू प्रिपेयर योरसेल्फ फॉर दिस सिंस स्कूल एंड कॉलेज डेज?
The nursing, I literally wanted to go ahead with the medical profession after my 12th science. But my parents forced me to into nursing. My own interest was in engineering and other field. But my parents literally counseled me and they become the role model for me. And they told me like healthcare need is much important and somebody from our profession
should be there.
Yeah, should be there in the field. So that that will be helpful for their relatives, the families as well, and they give me more motivation to be in this field. Unfortunately, I choose the same then. Thank you.
Dr. Vijay Patel sir is an inspiration for all of us. How has he motivated you?
Yes, sir is the really the good motivator for me. I don't know how the people are looking towards sir, but when I see sir, when he's come to visit us, come to our the different festivals that we organize,
Definitely.
I see sir is being such a big person, the big personality.
Oh yes, definitely.
The big empire the sir has been developed. Still the sir is very calm, very quiet,
composed, very humble.
so and he listen very carefully when we speak to the sir, and so that gives a motivation then who you and me are we are just started, we are doing our job, so where we have to reach our destiny, our focus, our aim should be like a sir has the goal has been set up, not to looking for present but sir look for the future. कल आज मुझे ये कॉलेज बनाना है, कल फ्यूचर में वो कॉलेज बनाना है, वो कॉलेज को लेके मेरे इंडिया, महाराष्ट्र को, मेरे इंडिया को
आगे ले जाना है,
आगे लेके जाना है, उनके लिए फैसिलिटीज डेवलप करना है. Now also sir has started to build up the cancer specialty hospital. So nobody has thought कि the cancer is one of the arising problem nowadays, and the cases are increasing more, and as you know there are hardly few hospitals are there. The specialty hospital, the Tata itself is the alone who is looking after the cancer management and care, but the sir has started this as an initiative, so definitely that kind of the goal and the thinking sir has. So we want to have a such thinking and the goal, and that's why the sir is the role model for us.
Okay. अब कुछ और सवाल पूछता हूँ आपकी फील्ड से. हाउ हैज़ द रोल ऑफ नर्सिंग इवॉल्व्ड ओवर द इयर्स एंड व्हाट आर सब key skills or attributes aspiring nurses should focus on in today's healthcare landscape?
Yeah, thank you. The question is a very good question that you asked. As sir, we know nowadays we are facing with the very much the challenges as a nurse, as a healthcare professionals. Important challenge that we are facing, that demand has increased nowadays in healthcare. So it's very become a very demanding profession nowadays.
Yes, yes.
Everywhere, like you go to the around world as well in the globe. So wherever the healthcare has become a more demanding profession. So
Yes,
we
yes,
require
yes,
the
yes,
number
yes.
of nurses, we require the number of doctors and other healthcare the supporters. But in the challenges as you asked me in the field of nursing, as the COVID-19 itself, it was a pandemic time. It's a great challenge to everyone. That time I remember even I was the part one who worked during the COVID-19 time. So initial phase as the COVID came and it is announced as the pandemic in India. So many nurses they initially because of lack of knowledge and not aware of regarding the COVID and the mass media, that effect was very much high on the people. So nurses had that initially they afraid and they little moved away from the profession. I saw many of them they resigned from the post and they have left. So I could say like in the such situation can be come ahead again and again.
Yes, yes, yes,
Right, this is
definitely.
not a one pandemic that we face.
Yes,
There are gonna be another more in future.
yes,
Right. So being a nurse or being a healthcare professional, they should not step back. They must be stay tuned with their profession. And for this, like difficulties could be, they may be deficit in knowledge, they may be deficit in the practice. So they need to get those skills so that they will not be afraid of such things. And now, like immediately, like that particular COVID was not a part of syllabus, but suddenly it has came and definitely it become difficult who can how I can face this. But as a nurse, like if she is connected with the globe, what is going around the world, what the global health burden diseases are, what the policies and protocol the people are following. One of example, Ebola virus, it is not commonly found in India, but similar diseases can be there. But as a nurse, she must go through it, how the situation going there and how they are managing at the certain situation. So that will help to solve the challenges as a nurse in India as well. So I just could say like she could come up with a very good knowledge like the research she must have. So number of the research will help to solve the problem, as well the good communication skill and the basic skill required in the field of nursing. So that basics the scientific skills she must have, so that she will not face much challenges in the field of nursing.
okay, nicely explained, sir. What makes our institution unique? Of course, it's a faculty like you, but what about the factors such as the infrastructure, cafeteria, lab and research facilities, the varied courses, and the general environment of learning and fun?
Thank you. So I'm very pleased to explain about my institute, and I'm working here. And there are certain things like which the thought has taken me here in this profession. As you said, the infrastructure, as we know and everybody is aware of,
Oh,
we
definitely.
have a very huge
So very
infrastructure.
huge
such a-
infrastructure.
Right. The space, the classrooms are very the spacious. The facilities are very good, like AC
Wonderful
classroom
state of art
facilities.
libraries are
Yes,
good.
yes, yes. Laboratories as well. One of the thing, the simulation lab we have.
Oh yes.
So like during, so I have the almost more than 10 years in nursing, but that simulation part, I done my masters. Till my master, it was just I read in the book. There is a concept of simulation. But when as I enter in this profession, I joined as a tutor in 2019, and then I first time introduced the simulation lab, and it was literally a wow factor for me. Like how where I am, and I'm not thinking I'm in India.
Oh,
So
wow.
the class of the I exposed to the different manichees and the type of management, the condition that we provide them, and through which we get recover. So that simulation experience was great for me. I know the few of the name as well, Lucy's and also the delivery manichees and all. So literally that gives the students and me as a more motivation to teach my students. So I take my students there and I teach basic procedure. So that part of infrastructure in DY, that is more awesome. Another thing that it was very I was enthusiastic to know the stadium. So in my before I think I joined 19 only, but before this I never come across the stadium, and I like cricket more. I really wanted to like see any of the match in the stadium, but that was my just thought
You are
like when
experienced.
I can do it, but that expectation never come true. But when I joined in DY, so I could see IPL, and so and I was one who that was like as a working as a advisor in the student advisor body. So I used to come across the stadium, the person, the managing bodies of the stadium, so that they used to give us the free of cost the tickets, and I used to take part into this as well. Our student also used to get part, and that make me more happiest person in the world. Even when the women cricket match was there, so that time my family member also took a part into this.
Oh, wow.
Even relatives come from my hometown as well, and they could get a part and they could see those matches. So that infrastructure, they also whenever they see that, the wow factor for us, the stadium point of view.
Okay.
Even if as you walk into the stadium, so the stadium is the completely the green campus is there around the world. So the green campus makes us more motivation over here.
Oh yes, oh
Yeah.
yes.
Even if cafeteria you look into the Legion cafeteria we have,
Yes,
that
yes,
also
yes.
one of the very the awesome the cafeteria we have in the campus. So this is all, even hospital, like we have the huge hospital and we are treating most of the patient with the free of cost. Even if sir, it's very honest to tell, I have a 2 months daughter, and the delivery I just happened here only,
Oh.
and it was a completely free of cost services. So
That's
thanks to the D.Y. Patil, so being a faculty member, I never charged not a single rupees for this. It was completely the free of services were provided. Plus additional, being a part of D.Y. Patil, they provided me side room facilities. It was equal to the suite as well, like the completely the privacy were taken very well. So that's very happy, like not only me, but I can trust DY Patil. My family is also getting benefited for the health and the sport, as I said, and many health point of view. This all possible because this precious campus we have over here.
Okay.
Thank you.
Nicely explained, sir. Now, what is your greatest lesson from your students?
So lesson, as earlier I said that we have the various challenges nowadays, and it is demanding profession. So I could give lesson to my student. They must come to fulfill the this demand first. As we have the various challenges, so the student must be capable to fulfill those the challenges, overcome those challenges by their communication skill, effective communication skill that we must use. As we know, when we come across any of the patient, so half of their problem would be sorted out the way we communicate with them. So that the key factor when we are treating with the patient. So not only this be in a skillful in the nursing, but communication is effective way. Because most of the time the patients, as in the field of mental health, as you saw, the trust building is a very key factor when we deal with the healthcare the facilities. Most of the problem that will be hidden phenomena, so the patient might not be open up. But as you have good relationship, like interpersonal relationship, that the key we use. If you have good relationship with the patient, so that will help to solve the patient's problem. So that one of the skill the student must develop in the clinical practice for the future. Another things I would like to tell, as we know, like we have enhanced in the technology, we have enhanced in the scientific base, the technologies as well, the various equipment and machineries, even protocol has changed, and we are the step up ahead with the various accreditation. Like our hospital is NABH plus, and another beyond that the accreditation we have received. So that level of standard what particular organization has received, and against that we have to provide the care. So definitely they must be equally skillful to provide the services where what level of accreditation hospital has achieved. Even if any JCI, one of the accreditation in the field of nursing we have, and so that is very the standardized accreditation one of organization has issued. So if they want to be a part of that organization, definitely that is one of the challenge. They must fulfill that level of care and the standard उनमें already होना चाहिए. Then only they are capable to provide the services there. So that one of the challenge that I would like to tell students, as the standardized care has been increased, so increase your standard to fulfill that level of demand and need. That one I could say. And earlier I said, as I explained one of scenario, the COVID-19, the people has step back. So that is one of the challenges can come in future, but they should not step back, and they must fulfill the care as well. The best challenging job to anywhere they may come across the challenges anywhere, but they must have equally the human relationship management skill. That one of the skill they must have, because any one of you, they want to survive in the organization, they must know what the need of that organization, what is the vision and mission of that organization. So what we can say, the objectives of that organization had set up. So based on that objective, the student must capable to provide the services.
ओके अब कुछ और चीज़ें भी आपसे पूछता हूँ जो आपके लिए इम्पोर्टेंट क्वेश्चन है. ओके, इफ़ यू हैड नॉट बीन अ प्रोफेसर यू वुड बी.
So I would not be a professor. Definitely, I would be a farmer.
Okay, okay,
Because my father is a farmer, and I always to help him the farming works. That definitely it's a good thing for me.
Okay, now this or that round. Now I'm giving you options and you have to choose one. Okay.
Okay, sir.
Veg or non-veg?
Veg.
Okay. Tea or coffee?
Coffee.
Gym or yoga?
Gym.
Okay. Early riser or night owl?
Night out.
Night owl.
Night out.
Okay. Emotional or practical?
Emotional.
Emotional. Okay. Books or Kindle?
Books.
Books. Okay. Mountains or beaches?
Mountains.
Okay. तो ये थे आज हमारे साथ प्रसाद कनावड़े सर, जिन्होंने बड़ी खूबी के साथ जवाब दिए थे हमें सारे क्वेश्चंस के. डेफिनेटली वी आर लुकिंग फॉरवर्ड टू कोलैबोरेट विद देम अगेन एंड विद हिम अगेन, स्पेशली विद द नर्सिंग डिपार्टमेंट. थैंक यू सो मच सर. इट्स आवर प्लेजर यू केम हियर.
Thank you, sir. It's really my pleasure as well to be a part over here. Thank you, sir.
वेलकम.